Hello, everyone. This is George Manalo Claire. We're going to get started in just a minute. So please go ahead and mute yourself. Make sure you are muted. We're going to allow you to unmute yourself later on during a Q&A session. Before we get started, we want to provide some instructions as we are using a second audio line to provide simultaneous interpretation in Spanish. So I'd like to ask my colleague, Angeles Nelson, to share instructions in Spanish on how to use this second audio line. Angeles, please go ahead.
Buenas tardes a todos y muchas gracias por acompañarnos hoy. Mi nombre es Ángeles Nelson y queremos invitarlos a que si le gustaría tomar la presentación en español, hoy tenemos interpretación simultánea. Lo único que tiene que hacer es apretar el botón que dice interpretación. Está en la parte de abajo, cerca de donde está el chat y las respuestas y preguntas. Si presiona ese botón, va a tener dos opciones, es inglés o español o apagado. Si presiona el botón de español, lo va a llevar a una parte donde van a hablar en español. La señora Margarita le va a estar hablando en español todo el tiempo. Si quiere apagarlo, puede poner en off o regresar al canal de inglés al presionar el canal del inglés. También tiene la opción de no escuchar el inglés en absoluto por presionando Mute Original Audio. Entonces, si presiona esa parte, ya no va a escuchar lo de español. También voy a estar en el chat. Si tienen algunas preguntas, las pueden poner en español y yo se las puedo responder o las podemos traducir para usted si lo necesita. Muchas gracias y que disfrute su presentación.
Thank you, Angeles. Welcome, everyone. This is an exciting day for us as this is our first event under our new name and brand. So let me just take a moment to acknowledge the changes that have occurred. You know, for over 30 years, we operated as California Food Policy Advocates, or more commonly the acronym CFPA that most people used. In our quest to be more accessible and to avoid the alphabet soup of acronyms, we are now Nourish California with the tagline, advocacy, equity, and food for all. We believe there are many ways to be nourished, and this word nourish can help capture our work at the intersection of a number of social movements, such as economic security, equity, immigrant rights, health reform, affordable housing, and many others. I won't go into all of the drivers of our rebranding effort, but let me just highlight one that is important for today's event. As you may know, we are not a membership organization, nor do we provide direct service. So how is our work grounded? Our advocacy stands on evidence and engagement. We stand on and lift up the actions and experiences of communities throughout the state. We stand on what we hear and learn, and that's exactly what today's event is all about. And given the crisis that we have all faced over the last 9 months, there is so much to learn and so much to process. So our listening continues with this Zoom webinar, not just in the report back of what we heard that you'll be able to participate in later, but also in this opportunity to engage and provide your own feedback and ask your own questions. So as you will see on the next slide, which has some logistics, we want you to be engaged. We want you to use the chat features and the Q&A features. We really do want to hear from you. So go ahead and get started in the chat. Introduce yourself and tell us where you're located. And while you're doing that, I will go ahead and point out our team members who are helping to make this event a success. You heard from Angeles a moment ago. She is going to be helping and assisting with the Q&A in Spanish. And similarly, our colleague Cameron Mims-Jones will be doing the same thing in English. Other staff, Melissa Cannon, Jared Call, Betsabel Estidio, and Gabby Tilley, they're going to be scouring the chat to answer questions, but also to raise up issues. So let me introduce the member of our team who's going to be hosting today's event. Tia Shimada is our Director of Programs. She takes overall responsibility for all of our programmatic goals and objectives. While many of you may know her for her leadership on school meals, her leadership of the organization extends beyond that specific content expertise. She leads our research agenda, and she is the driving force behind this research project, this engagement project, which you're about to learn more about. So go ahead, Tia, take it away.
Good afternoon, everybody. Tia Shimada. My pronouns are she and her. I am the Director of Programs for Nourish California and consider myself very lucky and grateful to be fulfilling that role. I want to say first, thank you all for being here. We know schedules are busy and time is tight, so it's great to see so many familiar names popping up in the chat box, and also really exciting to see names that are new to me. I'm going to start by just sharing an outline of where we'll be going between now and 2 o'clock. I'll share the briefest of introductions to provide some background and context to the heart of today's discussion, which is a presentation of key findings from recent statewide research that looks at the lives and experiences of Californians during this COVID era. Then we're going to dedicate some time to your thoughts and your input and your questions during a Q&A section, and we'll wrap up by sharing some next steps and some opportunities for action. Can I have the next slide, please? Well, as my team's advancing the slides, I'll just go ahead and say just a few words about what we do. You heard a bit from George about how we have reemerged as Nourish California, and our small but mighty team, we tackle policy development, advocacy, and research, all in the pursuit of a core belief that everyone in California should have access to the food that they need to thrive. We focus our efforts on our fellow Californians who face the starkest inequities and the greatest need. And while we'll use pretty much any strategy to get the job done, optimizing existing programs and advocating bold new approaches are really central to our work. Next slide, please. As a statewide organization, we serve all Californians who don't have fair access to nutritious, affordable food. Through recurring assessments, ongoing research, we continually look at needs and opportunities and consider stakeholder input. And in doing so, we've identified a particular focus on children, pregnant women and young families, immigrant Californians, and elders throughout our state. And you'll see this emphasis reflected in some of the research that we'll be sharing today. Next slide, please. In order for our team to do justice to our work and to our mission, we really need to understand the lives and experiences of folks throughout our state. And that's particularly true with all of the new challenges that we're seeing in the midst of the ongoing pandemic. So we need to ask questions like, what challenges are people facing? What factors are driving limited access to food and other essential resources? And on the flip side of the coin, what things are working and why are they working? And how can we build upon those successes? So to really understand both the scale and the specifics of issues facing Californians, we worked with a team of researchers at FM3 to conduct a statewide survey, stakeholder interviews, and a series of focus groups with community members. We'll be focusing the bulk of today's discussion on the survey and the focus groups, although I do want to note that those interviews also play a key role in our policy setting and understanding our priorities. So with that, I'm going to turn things over to Lucia Del Pupo. She's a vice president with FM3, and she's here to share more about the research that she and her team conducted and her insights on the findings. So Lucia, if you could take it away.
Great, thank you so much, Tia. And hi, everyone. So as Tia noted, we conducted a very broad research project on behalf of Nourish California, and it was three-pronged. It started with executive interviews with a variety of Nourish California's stakeholders, and these both helped them set their kind of policy agenda internally, but also really helped inform how we approach the next two phases of the research. What were the questions we asked and the need areas that had come up, particularly in this moment with the coronavirus pandemic. And so the next two phases, which is what the bulk of the presentation will focus on, were a survey of 1,000 middle and low income Californians, and then 6 focus groups among middle and low income Californians. So a little bit about each phase. There we go. So looking at the survey methodology, and I apologize, I clicked back and forth there because there was a little bit of a lag. So looking at the survey methodology, we spoke to 1,000 Californians. We set the threshold for participation as anyone with a household income of $50,000 or less. The interviews were conducted online, and we did these in the fall. So starting October 20th, and we wrapped up mid-November. And the interviews were offered in Spanish, Vietnamese, and Chinese. And then we'll notice throughout the presentation just a little thing that statistical blip is that sometimes the numbers don't add up to 100, and that's just a rounding item. So if you catch that, don't worry too much. It's just a rounding issue. And then moving on to the next slide. We also did 6 focus groups among different segments of Californians. And these were 2-hour-long moderated discussions where we really dove into different topics about public benefits and access to CalFresh and WIC specifically, and general challenges with food access that people were experiencing. As you'll see here, we strove to represent various parts of the state. We didn't cover every part of the state, but we did cover kind of a broad range of areas and different populations of interest that kind of align with the most vulnerable Californians to food insecurity. And additionally, we tried to conduct them in a variety of languages. Obviously, there are so many different segments and different communities that it would be valuable to do focus groups with, but we really focused on these ones. And throughout the slide deck, what we'll do is you'll notice that we're going to walk through first the stakeholder interviews and the key themes that kind of jumped out of there, and then how that kind of fed into our survey and focus group research. But because the survey and focus group research were so intimately overlapping in topics, we kind of merged those findings together in kind of the following section. So starting with the stakeholder interviews, some of the things that really jumped out at us in our conversations with the various stakeholders who represented different communities around the state, as well as those working to increase food access, were that the challenges were both varied, but had really been intensified by the pandemic. And some of the main challenges that arose that we saw among the communities that these organizations served was immigration status serving as a barrier to participation in CalFresh, particularly fear around public charge rules, and in general being afraid to ask for help because of disclosure of privacy. Language barriers. So obviously we live in an incredibly diverse state, and it just so happens that not every language is represented in the materials that are available, both on CalFresh and in other kind of organizations that support food access. And so that has become a huge barrier for many people. And then another huge challenge that people are facing is culturally appropriate food. And all of these themes, we'll talk about them more as we go through the presentation, came up with our focus group participants for sure, and even in some cases in our survey. And the culturally appropriate food item was just that many people felt like, you know, we're really grateful for the help we're getting from food banks, but maybe the food bank doesn't always have the food from that specific community that they would prefer to have. And it's not just food banks, it's also, you know, maybe the grocery store or other places. And then moving to the next slide, the list of challenges continues. And so the other kind of big list of challenges, oh, sorry, I jumped ahead, were logistical challenges. And these related to transportation. So transportation being a problem for people living in rural areas who, you know, previously maybe were carpooling, but with the pandemic no longer could. And older adults also facing transportation barriers, and similarly, isolation was a big issue for older adults. We heard this both in our stakeholder interviews and in the focus groups. The logistics around the CalFresh application, whether it was language proficiency in English or just complicated bureaucratic language, or not having internet access. And one thing we heard from stakeholders was the desire to, be able to have greater flexibility in filling out the application on behalf of their clients. Another logistical obstacle that unfortunately seems like it's here to stay in waves in California was air quality. So we did want to talk to people about, displacement, and it didn't seem because of natural disasters. And while that was a problem, the biggest problem, the most broadly impacting issue was air quality, making it hard for people to leave their homes to get services that they need. And then finally, racism was a huge issue. And I apologize, I'm having a little bit of a technical issue here. But one of the things we heard from our stakeholder interviews was that, again, we live in an incredibly diverse state, and many people felt like their community that has specific needs was being lumped in with other communities of color. And that kind of not only kind of centers white culture, but also washes over the very unique needs and different services that different communities in our state face. So that was one big obstacle that came up. In addition, environmental racism, food apartheid, this came up specifically in reference to the Black community, with being the most acutely facing food deserts. And again, poor environment, not being able to grow your own food, even if you wanted to. And then in general, we heard from our stakeholders that many of their clients face racism in their interactions when they are trying to access services or access healthy foods. And some of that is due to structural racism that exists. And some of that is, we are living in a time where people at the very top of our leadership in our country are not setting a good example and are being actively harmful in terms of racism. And so that kind of has affected people deeply. So that said, we will now move on into the findings of the survey and the focus groups. So starting, and I do want to pause and say that you should feel free to enter your questions in the chat, but we'll also leave some time for some Q&A at the end of the session. So we did ask people the kind of classic questions that get asked about food insecurity, about whether they had worried about in the past 12 months, if they would run out of food before they had money to buy more, or if they bought food and it didn't really last. And we saw that 63% said that in the past year, at least sometimes they worried about whether their food would run out, and half said that within the past 12 months, the food they bought just didn't last and they didn't have money to get more. So that's a very, very large number of people facing food insecurity at this time. And we also asked people about how much additional money they would need to get the food they need and want. And a majority said a great deal of money or a great deal of need for funds, or some need for funds. So definitely a majority saying they have additional need for funds. And there on the right there, that chart shows the groups that were disproportionately likely to tell us they had a great need. So 25% had a great need. And as you can see, there are people with no health insurance, no income, with kind of teenage kids, high school educated in their 30s. And the list continues. And so looking at the demographic groups of those people who told us that they worried about running out of food, what we see is pretty parallel, and we broke this out by various demographic groups throughout the survey, but what you see here is the biggest distinctions on this slide are when we looked at household income by household size, that we saw that regardless of income, the larger households were the ones that were facing the most food insecurity, were most likely to be worried or to have actually ran out of food. So in red, you'll see 72% of those with a household income under $30,000 and 4 or more household members were worried about running out of food, and 66% actually did. And then 77% of those with incomes of 30,000 and over and 4+ members. Not to say that it isn't prevalent among smaller households, but it's more acute among those larger households. And then, oops, again, I apologize for some of this jumpiness on these slides. We saw some, definitely some ethnic dynamics with Latinos and African Americans most acutely facing food insecurity. And then we saw some age dynamics again. Also, we broke out age by ethnicity. And what was interesting was that on the whole, we saw that often those under 40 were most likely to face food insecurity, or were telling us that they were running out of food or concerned. But among Latinos, there wasn't quite as the same level of age distinction that we saw maybe when we broke it out among white respondents or all people of color respondents. And again, I have to say that I know I just noted that we don't want to be grouping communities of color all in one, because there are so many distinct experiences there. But given the limitations of a survey, in some cases we have to do that to be able to kind of share statistically significant or reliable results. And then we also looked at parents. And what we saw, and we saw this in various parts of the survey too, is parents are really facing this experience acutely and facing hunger more so than others. So 74% of parents said they worried about running out of food, compared to 56% of respondents who didn't have kids. And 63% actually ran out of food, compared to 48% who did not have kids. So then moving to the next slide. We also asked people about the various challenges and barriers that they may experience in accessing food. We asked them to rate a series of challenges as a major challenge, a minor challenge, or not a challenge. And as you can see there, high food prices, really most common challenge, followed by not enough or inconsistent income. And then not enough social supports or benefits was a challenge for about half. From there, the categories get narrower, or the number of people saying they experience that challenge gets smaller. But what was interesting is when we looked at some of the different demographic breakouts here, we saw some dynamics that were really interesting. So a lack of transportation, whether it was the public transportation or car or personal vehicle, that was a bigger problem for those living in LA County and the Central Valley. And then we also saw in general across the board, Latinos, African Americans, and parents all telling us they were facing these challenges more acutely than kind of the average respondent. And then we also asked about things that could be helpful. And again, I jumped ahead there, sorry. We asked about different things that could be helpful to assist them in accessing fresh and healthy food for their families. And we see that free and discounted groceries was most often rated extremely or very helpful. It's 2/3 said it was extremely or very helpful. Money or vouchers to buy food and groceries, more funds via food stamps. So basically anything where people were actually getting the free groceries or the money to go buy it for themselves, those were the most helpful forms of assistance in accessing food. And we did see that parents particularly tended to find these types of assistance helpful. So then moving to the next section here, we also talked to respondents in the survey and the focus groups about some of their experiences accessing public benefits. So this is from the survey, and we asked people what public benefits they were even using. So remembering that our respondents are all people who have household incomes under $50,000. Over 1/3 were using Medi-Cal, 30% were relying on food stamps, sometimes called CalFresh EBT. We were trying to use a variety of language there to make sure people understood what we were talking about. Social Security, unemployment insurance, those were all kind of the top most commonly used benefits. And then when someone told us they were receiving a benefit, we asked them to rate how important that benefit was to them. And many people were receiving multiple benefits at once. And what we saw was that Medi-Cal, by far the #1 most important benefit, 76% of respondents telling us it was extremely important. And disability benefits, extremely important to 74%. Food stamps, very important to 68%. So overall, very high levels of value for those services that people are receiving. And then we also asked focus group participants about this. And many of the focus group participants were recruited specifically because they were using CalFresh and WIC or had had them in the past as we noted initially. And these were services that were hugely valued by both current and former recipients, saying even though some were no longer using them, or they had, different experiences in terms of how much of the benefit they were receiving, there was a uniform positive feeling of it was so helpful. Anything we can get, would love more. Many of the people who were not currently eligible because they were undocumented or other immigration status issues, or, some people were right above the income threshold for these, said that they wished they could access them because they really saw how valuable they were. Those who did not have access to CalFresh and WIC told us they were relying on support from community groups like churches, food pantries, and food banks. And then some were saying, I'm aggressively budgeting, I'm maybe not eating so my kids can. These very kind of tough decisions that people had to make. We also asked about some of the additional benefits and changes that had been made to CalFresh and WIC because of the pandemic. And so remembering that these included everything from moving in-person interviews to online, pandemic ABT, the emergency allotment, the ability to online shop for foods. And the strongest reactions tended to come to the emergency allotment and the pandemic EBT, in terms of those were the things that people really responded positively. Some had said, particularly with the emergency allotment, they were like, they didn't really always know why they had gotten it or what, but they were like, all of a sudden I started getting more money and it was really helpful. With pandemic EBT, parents were hugely grateful. And they did note that in some cases it took a few months to actually get the benefit after they had applied, but they were like, it's wonderful, we want more of it. I will note, and I should have made this caution early on, with focus groups, the responses are really valuable and they provide a lot of color to this data that we saw in the survey, but we want to be careful not to kind of extrapolate that too much, because it is still a few people telling us about their specific experiences. But on the whole, this kind of mirrors what we saw, right? That people are telling us that CalFresh is a very helpful benefit. And then when we have these in-person conversations, they're telling us, getting more of that benefit was huge. We also saw that being able to move to that phone and online interview format was helpful, particularly at a time where people don't really want to be going anywhere face-to-face. And then with the online purchasing, this was an interesting aspect of that had changed. So the ability to use your CalFresh benefit on Amazon, Walmart, and other kind of big grocery stores. And people were largely unaware of it. We did find that in the older adults group, people were a little bit more familiar with it and maybe had used it a bit more. But one thing that this was only one participant, but I thought it was a really interesting point noted, was that some of these big box stores have delivery minimums. And when you're on CalFresh, she was like, I can't necessarily spend $35, $40, whatever it was, to get that minimum at that time. So I can't use the online purchasing. So an interesting observation there. Other types of help that people got during the pandemic included the stimulus payment. So 3/4 said they got the stimulus payment, with a majority, 3/4 got the stimulus payment or the unemployment benefits or both, and half got just the stimulus payment. But on the whole, very helpful, as we know, and hopefully more to come. And then when we asked people exactly like what types of assistance had been most helpful, and I apologize, a computer there jumped ahead again, but we did see that the stimulus payment and getting that cash was the most helpful benefit that they had received. And then apologize, my computer is not wanting to go back to that slide, so we'll just move on to this one, which is, so we did see that half of the respondents who said that they got extra CalFresh funds, this is in the survey, during the pandemic, so that emergency allotment, we asked them, okay, if you told us that you got extra funds, did those additional funds help to make your benefits last through the whole month? And 2/3 actually said it did help, and 1/4 said it didn't make a difference. Only 1 in 10 said the additional benefit didn't help extend them through the month. And then 3/4 of those who got an additional benefit said that these allowed them to purchase a greater variety of foods than they normally could. So there were also a lot of challenges and barriers to accessing CalFresh and benefits that we discussed both in the survey and in the focus groups. So one of the questions we asked was whether people had faced racial discrimination when applying for public benefits. 20% told us that they had faced racial discrimination and bias. And that 20%, we asked them, well, did that experience make you less likely to apply for services in the future, or did it affect your likelihood of applying in the future? And as we saw here, 80% of people who experienced racial discrimination and bias said that they were less likely to want to apply for public services in the future. And the groups most likely to face racial discrimination and bias by ethnic group were Latino and African American respondents. And then we asked the similar question about language barriers. And 1 in 10 told us they experienced language barriers. And 90% of those who experienced those language barriers said that it also made them less likely to want to apply for services in the future. So having seen this very rich and important in data from the survey, we also talked about this in the focus groups. And what was really interesting is that, and again, keeping in mind that focus groups are not, while we recruit to be representative, are qualitative exercise by nature. But what we commonly heard was not that people were facing what they perceived to be discrimination based on their ethnicity, but in some cases it was just by virtue of being there and asking for help. They felt like they were in a position where they were looked down on, and that kind of treatment made them less likely to want to ask for help in the future. And then we heard distinctly from a few male participants saying that they felt embarrassed to be in a position of asking for help for their families. And some reported that they actually felt like they were treated differently or judged by the benefit workers. And one person reported having to actually kind of bring his kids in to prove that he was their primary caregiver. So even though the people in our groups didn't really face racial or ethnic discrimination, they said there were definitely other forms of discrimination that they were dealing with. And then moving ahead, we also talked about some of the other experiences when people were applying for CalFresh. And we asked people to rate, this is in the focus groups, how easy or difficult applying for CalFresh was for them. And as you can see, the bulk of the people kind of tended to fall into that somewhat easy, somewhat difficult category. The challenges really came back to kind of, they felt like the benefit workers maybe were rude. They were confused about paperwork, confused about their eligibility. There were language barriers that were not always just, you know, I'm applying and I'm not a fluent English speaker, but some of it would be the worker, maybe they didn't understand, or, you know, I'm a native speaker, but the language being used in these forms is very confusing for me. So there were a lot of different types of challenges that people were facing. Those who had experience with both CalFresh and WIC tended to find WIC easier to apply for and deal with than CalFresh. And then looking specifically at meals for parents and childcare. So we asked a series of questions in the survey of parents and guardians with children up to 18. And we also had some focus groups dedicated specifically to talking just to parents, and in some cases, parents of young children. So a majority said of parents in the survey told us that their children's school offered out-of-school meals. And 2/3 actually said that they had taken more advantage of this benefit since the pandemic started. So as you see here, a majority is saying that their school offers meals when they're out of session, and then 2/3 saying that they have ever gotten those meals. And that 2/3 is 2/3 of those whose school actually offers those meals. Those most likely to have gotten the meals were Central Valley and lived in the LA region, were in their 40s and had household incomes between $30,000 and $40,000. They were the most likely to take advantage of these. And then we also asked a series of different characteristics because we were interested to see how parents viewed school meals. And so what was interesting is that overwhelmingly people felt like they're convenient. They allowed their family to save money. They were for people like them. They allowed their kid to eat a hot meal and gave access to healthy food and allowed them to save time. I wanted to we split samples. So one half of the sample heard, these school meals are for people like you versus they're only for low-income families. A majority still agreed that they're only for low-income families, but it wasn't a very widely held perception. There was a perception that a lot of different types of people are taking advantage of school meals. We also asked about challenges to accessing school meals, and I apologize, my computer skipped ahead again there. And what we saw was that limited ability to go outside because of poor air quality or safety. This was the biggest challenge. This 60% said they faced that challenge. Other major challenges were meal pickup times, lack of information, low quantities of meals, and limited access to transportation. Not having the information available in their language was a challenge for 38% of respondents. So not a majority, but definitely a notable segment also facing that challenge. We also had this conversation, as I noted, during focus groups. And many saw it really in the same way. These experiences reflected what we saw in the survey, where it was, people felt like it was helpful from a cost and a convenience perspective. They didn't have to make lunch or worry about, spending money on it. But they did note that sometimes their kids were not impressed by the quality of the food. So it didn't really matter if it was available, their kids would kind of reject it, or it would be kind of a bit of a fight with their kids on the pickiness around that. They did feel like accessing the meals since the start of the pandemic had been relatively easy. They said, I just go and show my child's school ID, or in some cases that wasn't even necessary. But like we just saw on the previous slide, long lines for pickups, inconvenient pickup times for those who had to work during the day, and then the distance of actually having to travel to the school to get the food, those all created barriers to actually continuing to use this benefit. We also conducted a focus group with older adults and had a segment of the survey kind of dedicated to those 65 and over, asking them about their experiences with food access. What we saw, interestingly, with those 65 and over, that the most prevalent challenge in accessing food services and supports was the concern about the spread of the coronavirus. So I'll talk about this a bit more in a second, but we did hear this in the focus group as well, that, people are not, older adults, as we all know, are most impacted by this pandemic. So we're least likely to leave their homes in this period. And that really is, there's an overlap there with food access. Other kind of notable challenges that maybe weren't affecting a majority, but were affecting a big segment of older adults was fixed or low incomes, making it hard to afford the cost of food, and then mobility issues. About 1 in 5 said they lacked information, and then transportation to meal locations was a challenge for 12% of older adults. So as I noted, we did have this conversation with focus group participants, and largely what they were telling us, which was really interesting, is this came up in conversation almost immediately. We had planned to talk about social isolation, but they brought it up first. They told us this is the biggest issue facing us right now. We are lonely. Many of the people we spoke to maybe lived with their families, but said, I have a friend who doesn't, or a sister or someone. And they said that their segment of the population had been really focused by this isolation, affected by this isolation caused by the pandemic and the inability to kind of go outside, maybe run the normal errands that they would run that would allow them to have those face-to-face and social interactions. Many in the groups that we had didn't really face transportation barriers. They were active or able to kind of access transportation, but many also knew people who did have those challenges in accessing food. And finally, we also spoke with different segments of the immigrant population, which obviously is hugely varied, but what was interesting was that it became very clear from our conversations in the focus groups that participants who are immigrants were well aware that their options for help were more limited than they are for other people like citizens. And it was interesting that we had one focus group that was specifically either children of immigrants or people who were in DACA or TPS status. And they tended to be less familiar with the differences that immigrants face, even though maybe they themselves, as the conversation went along, realized that they were like, oh yeah, I wasn't able to apply for CalFresh, or I haven't asked for help. So there was kind of an age dynamic there, and many immigrants said they rely on food banks and churches to kind of fill those gaps that CalFresh would fill. And this was where we kind of talked a little bit also. This was something that came up in our stakeholder interviews about the cultural appropriateness and the availability of food. And this also came up in the focus groups. I think I remember someone in the Cantonese speaking group saying, I don't like American food, but that's all they had, so I'll take it. And obviously that's tough to deal with. And then overall, there was a pretty prevalent concern about asking for help and the connection that has with the path to citizenship. Whether someone was intimately familiar with public charge or not, there was still this sense that those two things are connected. And there was a distinct sense that, a Biden presidency, and I believe we conducted these focus groups actually right around the election. And there was a sense that, this change that was coming would make it easier for them to be able to get the help, and that they had noticed the difference with the Trump administration. So here are some of those comments from the focus groups. I hope you had a chance to kind of read them as we've been going throughout the slides, but as you see here, really reflecting those that summary just said, you have to go to food banks to get food. You take whatever they give you, or in the young adult group, the person who says, I don't want to ask for help. I pay for everything in cash. I try to avoid getting help, even though I pay my taxes and I should be getting help. And I should note that was actually a really interesting thing that we saw, was that the people in the young adult group particularly seemed to connect the idea of investing in immigrants as a long-term way of building a healthier society. They innately got it, like we pay our taxes. Everyone in the immigrants said, I pay my taxes, I should be having help, or access the same programs. But the young adults really connected that idea of like, well, we're gonna kind of, if you help us now, we can give back to society in a better way, in a more stronger way, and be more stable. And they really understood those long-term costs that come from not having food access and not having access to services. But in general, and we also asked about the idea of extending food benefits to include all immigrants, and if that was something that people wanted or didn't want. And there was broad sense that yes, that would be really helpful. That is something that we do want to be able to participate in. So with that, I realized that we zoomed quite quickly through a lot of data and a lot of content. I know that there have been some questions popping up in the question box, but I will let the Nourish California team kind of, I'm happy to answer questions on the data, but I'll let them field those questions.
Thank you so much, Lucia. That was fantastic. I do want to let folks know, and I apologize for not flagging this earlier on in our conversation, but the webinar recording today, as well as the slide deck from today, will both be emailed to everyone who registered, as well as posted on our website. And what's being presented today represents a slice of what we found through these research findings. So we will also be making available the fuller set of findings. We would love to have been able to present all of it today, but we would have had to take probably several hours of your time. And so we appreciate your patience and your flexibility. We wanted to share key findings today and recognize that there are many more things that folks would like to dive into detail, and that will be at least partially shown in the fuller slide deck that we're able to show tomorrow. But Lucia, I did want to flag some questions that have been coming up to see if you can tackle them. The first one, we got a question asking about the representative nature of the data, especially if you're looking at the survey. How confident can we feel in taking those findings and generalizing them to populations within California, or perhaps the statewide population as a whole?
Yeah, so it was a population, it was statewide, and it was everyone with a household income under $50,000. So it's not everyone statewide in terms of, it is definitely focused on a certain segment. And we did use an opt-in panel to recruit participants. But that said, we did also use census data to ensure that we were proportionally representing people from the state. So unfortunately, because of the nature of an opt-in panel, I can't give you like a margin of error in the way I could with a survey that is truly random, but we feel very confident in the representativeness of this data.
Great, thank you. And then along similar lines, we had a question about, you just answered in terms of geographic representation of the survey, but in terms of the focus groups, can you let folks know where geographically the representation of folks in those focus groups?
Sure. So we did I'll just kind of go through them one by one really quickly. They didn't cover the whole entire state, but we did do, for example, the young adults were drawn mostly from the Inland Empire and the broader LA region. We did 2 groups with the broader LA County, LA region, 1 group with Bay Area respondents. The older adults group was drawn from the Sacramento area and then into the Central Valley. So it was a pretty broad geography there. And actually, sorry, I should apologize. We did 2 groups in the Bay Area. The Cantonese speaking group was also drawn from Bay Area, and primarily it was San Francisco.
Great, thank you. And then just a reminder to folks, please keep your questions coming in. I will say we've got a lot of them and we likely won't be able to cover all of them in real time, but we will be doing our very best to make sure that we follow up with every question that got submitted today, even if you don't get a live answer on the webinar this afternoon. There's a couple of questions coming in, Lucia, about more specifics about barriers to access. Somebody's asking specifically about access to public transit or concerns are related to public transit and whether or not folks felt like that was impairing their access to food.
So that didn't come up specifically a lot in the focus groups, but it did come up quite a bit in the survey. We saw that it wasn't maybe a top tier issue, but it was an issue for a segment of the population. I can pull up that number. And then also, as I know I went through this pretty quickly, but it was a bigger issue for those living in LA County and in the Central Valley than it was for people in other parts of the state, which was interesting for sure. So it was about a third of respondents, 36% said that a lack of public transportation was a challenge for them. And then it also came up in our stakeholder interviews for sure as something that people saw their clients facing.
Great. And recognizing that nutrition programs were operating under really unprecedented conditions, and we were seeing waivers from the federal level that allowed us to do things that we haven't been able to do before. There's a question coming in asking about the nature of applying for programs like CalFresh in the middle of the pandemic and whether or not we were hearing things through the survey or through the focus groups about were there things that were easier and were there things that were harder because of the way programs were being administered over the course of the pandemic?
Yeah, I think what we did here was that the move to doing things on phone and online. In the focus groups, we heard primarily positive things about that, that people liked it, that they didn't have to worry about getting to an office, they didn't have to be face-to-face, they could do it more smoothly that way. But again, in our stakeholder interviews, we did hear that for some people, whether it was internet access or just kind of technological fluency, those were issues that they saw. So in general, I would say that access actually had seemed more positive from the focus groups, but there are other challenges that maybe didn't come up in the focus groups that we know are out there.
Great, okay. And we've got a ton of questions, and just give me a moment. I'm trying to move through them. Somebody is asking about, I know, is asking about what we learned, if anything, about the charitable food networks, so food banks, pantries, et cetera, and whether you had anything related to that channel of food access come up in the focus groups, or if that was anything we learned from the survey as well.
Yeah, so I will say the bulk of the discussion really was focused on CalFresh, but we did hear, particularly in those immigrant groups, that those food banks are playing a hugely important role in filling that gap where people who are saying, I can't turn to programs, to public services, but so they were turning to food banks. I know we talked about it in the survey. Let me quickly kind of look through, but in general, yeah, the feeling was people were really grateful for the help coming from food banks. It wasn't, I feel bad because I realized that I kind of spoke about it in kind of the issues with food banks, but we did see that they were something that people did rely on and value in the focus group. But yeah, like I said, the bulk of the discussion was focused on CalFresh. So.
Okay, great. And someone's asking in terms of whether participants in the survey were provided an incentive or compensation for their time and their input.
So we did not, but the nature of a opt-in panel is that people are choosing to participate, and in some cases the panel provider will compensate people. It's usually a very nominal compensation, very, $1 per survey type of thing. But so we didn't add any additional incentive though, and beyond that, kind of what they get from choosing to participate in the panel. Although I should note that all focus group respondents were compensated for their time.
Okay, thank you. And folks having quite a number of questions about how the pool of respondents breaks down demographically. And I'm saying particularly questions about whether or not we had respondents from rural areas of California beyond urban and suburban areas.
Yeah, we did have geographic representation throughout the state. So it did include rural areas, the northern part of the state and Central Valley particularly. I know those are the kind of biggest rural swaths of the state, and they were definitely represented in the survey. We strove for kind of proportional geographic representation throughout the state for these populations. And then in the focus groups, I know that we tended to focus on kind of those larger urban centers, but we did have groups, as I noted earlier, with people from the Inland Empire and participants from various parts of the Central Valley.
Great, and I will say to everyone who's on the line with us today, if you do have more specific questions about methodology, happy to get those answered, or more questions about content. So again, happy to take questions now, but also if folks want to follow up, my contact information will be giving on the last slide, and you can certainly reach out to ask questions of our team, and we can also funnel questions to the FM3 teams for anything that's beyond our expertise. Okay, I see a couple of questions coming in about where do we go from here? So this is a really rich source of data and what next, and we are going to spend a few minutes at the end of the webinar sharing some opportunities to take action, as well as showing some examples of what we learned from this work, how it's affecting our priorities at Nourish California and how we're moving forward. But I just want to give one last opportunity for folks to get their questions submitted related to the data and the findings. Just seeing if any new ones are coming in. Okay. Again, there are many questions that we weren't able to get to today, and we do appreciate all of your interest and all of your great inquiries, and we will make sure to follow up to get all those questions answered. But if we can go to the next slide, please. While we're getting that teed up, want to say thank you again to the team at FM3, and really to everyone who participated in this research, the stakeholders who give us their time and input, as well as the panelists and focus group participants who give us their time and insights. It's invaluable to our work, and we truly appreciate all the effort that went into getting this work done. What we learned from this research is going to shape our priorities both in 2021 and beyond. Wanted to share some links here just to give examples of how we're incorporating what we heard and what we learned into our work. This first link is to our state legislative agenda. This is one example of how we are keeping the findings from this research front and center. You'll see as you look over our agenda, and we do invite you to visit the website and take a look. We think it should be easier for people to get help through CalFresh, especially older adults and people with disabilities. We know more kids need access to free meals at school. We want adequate funding for nutritious meals in childcare, and we need nutrition programs that are truly inclusive of all California immigrants. If these are values and priorities that resonate with you, we hope that you'll join us in advocacy this coming year. There are 2 opportunities coming up. The California Hunger Action Coalition is hosting an advocacy and lobbying week. You can find more information at the link provided. And you can also find more information about this on our events page at Nourish California, so nourishca.org events. There's also going to be an advocacy day on childcare and ending child poverty in California. Again, 2 opportunities to take what we have learned and turn it into action, making sure that our state leaders hear about the changes that we want to see across the state. Next slide, please. And then wanting to be respectful of everyone's time, we appreciate you taking this hour to be with us today. We'll be posting the webinar and recording and the full report at nourishcalifornia.org. We'll also be sending that to everyone who registered for the webinar. We'll do our very best to tackle all the questions that we weren't able to answer during the Q&A. And if you have any questions over the coming weeks or months, you can find me at tia@nourishca.org. We welcome all of your questions, all of your input, and really look forward to staying in touch with you across the year. So with that, I will say thank you to everyone for joining in. Please stay safe out there, and please do be in touch. We look forward to continuing to connect with you across the year. Thanks so much.